All right. Good morning, everyone.
Hello.
Good morning.
My name is Zolani. Most of you know me as Zoro. Okay. Today I'll be leading today's session about HIV care in the HIV care culture in the workplace. So let me just first introduce everyone. Let me welcome you all, Mr. Uncle Paul, our debrief manager, and Sibyl, my colleague, Spiso, my colleague, and Cindy, my colleague as well. So, all right. And the apologies we received today is Sudeshin. Sudeshin is on night shift, so he won't make it to the meeting. All right. Before we dive into it, let's briefly review the previous minutes meeting. Uncle Paul?
Cool. Item 1, Peter Maritzburg leave issues. Task assigned to Keshni to call Koba. Task marked as completed. Item 2, Douglas to assist PMB Depot with not yet dispatched PODs. We're waiting for an update from Douglas. I assume he's done that because that's an ongoing. Item 3, ensure no redeliveries on country routes. Task assigned to Douglas. It's still in progress. That'll be an ongoing. Item 4, move lockers to change room. Task assigned to Nisha. This task is marked as completed. And item 5, shelves to be taken from the storage room. The task was assigned to operations team members, and this task is also being completed.
All right. Thank you very much, Mr. Paul. Okay, let's dive into it on item number 1. Today we're talking about HIV in the workplace. So my presentation is all about HIV care culture in the workplace. So the first item you will see there. The first item on the agenda is HIV in the workplace, facts and fears. Because we all know that people are scared of the HIV and all those things. And for example, accidents do happen in the workplace. So it's crucial that we prioritize safety first, like using surgical gloves when assisting someone who's injured to avoid direct contact with the blood. This isn't just about HIV, but it's a general workplace safety. And there's such fears about sharing utensils or touching the same surfaces and all those things. HIV does not spread through casual contact. So that misinformation fuels stigma, and which is what we're trying to fight. Right? Okay. And we need to educate everyone in the workplace about HIV. Everyone needs to feel respected and supported regardless of their HIV status, right? Okay. We will move to item number 2. The item number 2 is the ability of infected people to work. People living with HIV are fully capable of performing their duties like any other employees. With proper management of their condition, through treatment and care, they can contribute effectively in the workplace. HIV status does not define one's ability. It's essential to ensure that our workplace promotes equality and provides opportunity to everyone without discrimination. And we need to create a supportive environment, such as reasonable accommodation for medical appointments, and so that they can balance their work life and their personal lives as well. All right. Thank you. If anyone has a question, you guys, you are welcome to. I'll take questions as I'm presenting.
Okay, so my question is, how do we help employees feel less alone? The ones that are HIV positive, how do we make them feel less alone?
What we can do, maybe we can create support groups or activities where everyone can meet, and then we can discuss such issues and get everyone on board, involved, and all those things. And then if we have that communication, those groups, those support groups, everyone will feel more comfortable, and then they can be able to cope with the condition they have, right?
Cool.
All right, thank you. All right, let's move to the next item on the agenda. So our next item, okay, sorry. All right. Our next item is embracing lifestyle changes for healthier life. Because we know if you are HIV infected, or if you sick if you're not HIV, but you have to change the way you live or what you eat. So a balanced diet is essential to your immune system. Individuals are encouraged to watch what they eat, ensuring that they consume nutrient-rich foods, right? And they need to exercise, like physical exercise. It will help as well with their mental health. Staying active is key component to your health lifestyle. And you must make sure that you attend your appointments, you take your treatment accordingly to manage your HIV effectively. And also we need to make sure that you practice safe sexual practices, such as using protection to prevent the spread of the HIV, and to prevent yourself as well to get reinfected. Because when you take the treatment, you need to you trying to slow down the virus, and you get your viral load down. So now if you think because you HIV positive, you don't care anymore, you will get reinfected and all those things. So it's pointless for you to take the medication and then you don't practice the safe practices. So it is pointless. All right, let's move to the next item, which is employment and HIV/AIDS. We're raising awareness and providing support. So SG Consumer is dedicated to creating a workplace that is free from stigma and discrimination. Everyone's goal is that everyone, regardless of their HIV status, has their health, safety, and rights are respectfully and they are protected. No one should be discriminated, no one should feel treated unfairly because of their HIV status.
So I've got a question. How do we prevent the stigma?
The stigma. So we need to educate everyone. Everyone needs to be educated about the HIV. Because if people, they have less information, then that will fuel stigma, you see. So if everyone is educated, they are aware. That's why we need to launch those awareness campaigns and stuff to make sure that everyone is involved and they are educated.
Can we offer help for mental health to employer with HIV?
Yes, we can. We can offer and other support programs as well. So that will help them to cope with their mental health. So counseling is, I'd say counseling. Yes. All right. So where were we? All right. So we're still on item number 4. Raising awareness and providing support. So employees living with HIV, they need to have the same access to benefits as anyone else, regardless of their status. And we can also have maybe voluntary testing. People can get tested. They don't have to really disclose their status, but we can have those programs where people can go there, they get tested. That information is confidential, and it's up to them if they need to disclose or not. All right, let's move to the next items. All right, the next item is we overcoming barriers, challenges, fostering HIV care. So the challenges people that they face, they avoid their clinic, they don't attend their clinic appointments because they do not disclose. And if they do not disclose, that means they can't stay away from work. They need to be at work because they are fearing to disclose. So if they need to be at work, that means they will miss their appointments. So that's one of the challenges. So in hiding that thing psychologically, it's not good for them. They have a psychological stress. I think that's what they call it. Because now they have the they're hiding their status, they have a fear of disclosing and all those things. Because as we know that stigma is real, people get discriminated and all that. Maybe they will think, okay, because I'm HIV, I will be given less task or less challenging task and all that, or I'm not gonna get that promotion and all those things. So we need to foster a care culture for HIV people in the workplace. And the policies, maybe we can speak to management, they can be flexible as well, so that they can be able to go and attend their clinic appointments and all those things. All right. Right, let's move to the next item. Okay, the next item is the universal precautions. So we need to know that we have first aid box and all those things. Yes, we should have those things, and they should be well stocked to care for anyone who's unwell in the workplace, regardless if they are injured or they are sick from anything. But and everyone should be, most employees should be trained how to care for people who are HIV positive, and they know how to administer those first aid boxes and stuff. And we need to practice, because I saw during the COVID, we were all practicing hygiene, and people wherever they go, they wear masks. If they touch things, they will sanitize and all those things. So we need to do those things. We must keep hygiene. We must keep hygiene. Sanitize, make sure you wash your hands and all those things. That I can encourage that. All right, and let's move on to the next item, which is most done here. So this agenda item is prevent, treat, flourish. So cast the resources and treatment to combat HIV. We have programs and organizations that offer help, and the NGOs that offer help to HIV people. For example, we have SANEC. They coordinate efforts to prevent and manage AIDS, offering resources on prevention, treatment, and awareness. You can visit them on their website. It's on www.sanec.org.za. They also have their numbers, you can call them as well. We also have the South African AIDS Foundation. They also offer treatment and provide community support. Like we said earlier, that we need to have those support groups and everything. So they do, if you can check them out on their website, they offer those programs, so you can be able to cope. And there are treatments for HIV, guys. If you are HIV positive, it's not the end of the world. You can treat the HIV, you can live a normal life like any other people. Just because the HIV doesn't mean, okay, I've got 10 years. You can live your normal life as long as you take your treatment as you are told. And we have ARVs. ARVs, they're not going to cure the treatment, but they slow down the virus. Then your viral load will drop and you to live. And they have PrEP these days. You can have PrEP. Maybe the PrEP will prevent the high risk of getting infected. Maybe if you know that you will be exposed, or you have a partner, you will be exposed. Let me say that way, you will be exposed to HIV and all those things. So to prevent, you need to take PrEP. If you go to the clinic, they'll tell you about those things, the PrEP, and then they have the other one they call PEP as well. If you know that you was exposed to HIV and all those things, and within 72 hours, you can take those pills. But if you go to the clinic, I'm sure they can tell you more. But we have the treatment that can help us reduce the spread and live a healthy life. So together with these resources, we can help prevent transmission and support individuals that are living with HIV. Right. And in closing, guys, HIV is not the end of the world. We need to foster those programs and launch support groups and stuff. We make sure that everyone is aware, everyone is educated about AIDS, people with HIV, they're capable like everyone else. It doesn't mean they're less capable of performing their daily duties. So we need to keep them respect, make sure that everyone is educated about HIV. So that's it. And maybe now we can talk about the general items. And for my general items, it's open. You can suggest any topic, and then we can talk about it. There's nothing specific. Anything that you guys would like to talk about, or that is not, even if it's not HIV related, anything. It's just general.
I'm good, thank you.
Okay. Or maybe we can talk about the Christmas is around now.
Christmas is close.
Yeah, it's very close. Maybe we can talk about Christmas party or something. And what we're doing on Christmas party. And then we can, what you call?
Yes, Christmas party, I think is supposed to be any family or anyone or friend. Can sometimes someone can present.
Good idea.
Is and then on a holiday during the Christmas, don't take strong drinks.
Good thinking.
Yes.
Yeah, and I also have a suggestion for Christmas. You can have people coming to test everyone at work.
That
Okay,
is a good idea.
good idea.
Yeah.
Strange.
I agree with that one.
Strange but good.
Yeah.
Okay.
Okay, so I think we're done for the day, and our next meeting, I think it's on the February, next 15th of February next year. You guys, you can have a fantastic festive. Make sure you enjoy, and then we'll see you next year. Thank you very much.
Thank you, Zolani.
Bye, Karuma.
Thank you.
Thank